Good afternoon. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center, coming to you live from CGH Medical Center today. Thank you for taking the time to listen in. And as always, in the course of this broadcast, if you have questions, send them my way and I will do my very best to answer them. And if I don't know the answer, I won't tell you one. We'll find it and we'll get back to you. So, as usual, today we're going to go and we're going to talk about the latest facts. We're going to talk about some news related to COVID. We're going to talk about some questions that are running through my mind about COVID right now. And then finally, we'll get into some opinions and analysis, if you will. But I would want to start with some facts. So our trusty AV person, Matt, is going to throw those up there. Okay, so that's the weekly update for Whiteside County. And the top left is the red is last week and the blue is the week before that. And then the bottom part there is last 2 weeks is red, and then the 2 weeks prior to that is blue. And then as you go on both of those graphs, as you go along, it shows you for different ages, the cases and what cases there have been for different ages. And a couple points on that. First of all, as you look at the ages, it was what you're reading and hearing about. It does tend to be a younger crowd that's getting sick right now, as some more so than the older crowd. And then a piece of good news from my perspective is this week, that red line on the top left is smaller than the blue line for the first time in a long time. So I don't tend to hang my hat on just 1 week's worth of data, but if we're talking next week and we see the same thing, then we would say, at least in terms of the actual cases in our county, that's encouraging that we've hit the crest, if you will, of this current Delta surge. So fingers crossed on that. Bear in mind, and this is the sobering part about that, is just because the surge in the general community, let's say it's this week or next week or the week after that, which I sure hope it is, that surge doesn't fully hit the hospital for about a month. So in terms of the number of patients we have in the hospital that we're taking care of, and some really sick people that are here, and the staff that have to try to take care of them, there's about a 1 month delay on that. So yeah, that's just the reality of the situation. You can see on the right there, case counts. You can see on the bottom there, on the bottom right, kind of the numbers, and reflective of a surge that we're experiencing now. So we'll hope that begins to go downward. We'll see. And the positivity rate in our county is encouraging. It's 3.4 as of the 15th. And it's definitely trending lower than it was a couple of weeks ago, when it was more in that 5 to 6 range, if I remember right. So that's all good stuff in terms of the infection. Thanks, Matt. I did happen, before he shows actually he does have another one we want to show you. So this is something I get this every day from the Illinois Hospital Association, and it's IDPH updates. And I just kind of highlighted a few things. I thought seeing them as well as me just saying them would be helpful. So this was yesterday. I think it was yesterday. This is what I received. So 4194 new confirmed and probable cases, and 44 additional deaths in the state of Illinois. And you go down, 29 individuals in the hospital. 537 of those were in the ICU, and 305 were on ventilators. And then the positivity rate in the state is 4.8%, which is better than, it's kind of trending down, which is good. And then you look at the top right here, the vaccines administered, rolling 7-day average is 21,255. And IDPH reports 62.6% of adult Illinoisans 18 and older have been fully vaccinated. while 80% have at least one vaccination dose. That's up, it continues to inch upward. The vaccination rate per day is definitely not as high as it was a few weeks ago. And then the Centers for Disease Control and Prevention, the 7-day average of 139,000 cases with 660,380 deaths noted. And I thanks, Matt. And I saw another piece of information today that I didn't end up posting here, but this past week, the CDC says that 1 in 500 Americans now have died of COVID, which is a pretty sobering number. And there are about, right now, their last week, there have been 1,805 deaths a day per day of COVID going on right now. So, yeah, still sobering information. Let's see here. I wanted to share some news with you, and definitely some stuff has come out in the past week. So just on Wednesday, I believe it was, the FDA panel, there was an FDA panel that put out their recommendation. And from their perspective, they didn't feel like, this is regarding the Pfizer and getting a third shot of Pfizer. They didn't feel that given how effective the vaccine was still right now, that would be a good fit. They recommended against that. However, there will be that goes into a piece of information that a group that gets together tomorrow will take into account, along with other information, such as information from Israel and other information that Pfizer has, to make a final recommendation on booster shots for the U.S. for at least the short term. So I think that is still, it's definitely trending towards not everyone being recommended to get a booster, and time will tell about whether or not perhaps some older age groups, like another piece of news is in the UK, what they've decided based on the data that they've looked at is they're going to recommend booster shots for folks over the age of 50, but not others. And they're also kind of going pretty loose in terms of masking and that type of stuff in the UK. The Illinois mandate is, so that the governor pushed that back a couple of weeks, but now that is kicking in. And so if you haven't been vaccinated, starting next week, you need to be tested every week. So that process will be starting next week. I saw something that was concerning. It was indirectly, it was related to COVID, but it's not COVID itself. And that is the CDC put something out that from 2018 to 2020, the number of states with I forget the percentage of their population that was obese doubled. So I went from like 9 states to 16 states that I forget the percentages. I should have looked that up. I'm just not going to rattle off a number if I don't know what it is. But I do know that Iowa is one of the states that was added. Illinois is not in that category. And it was felt that part of the reason for the sharp increase in the last couple of years in the data was related to COVID. And we know as we've been reading that it's not uncommon for folks to have put on weight during this period of time because of stress, because of the diet, because of activity and those type of things. What other news did I want to share with you that I thought was pertinent? Continues to be an issue across the country with staffing, trying to staff hospitals, nursing homes, and getting, just having the staff to take. We're more and more seeing that we have beds, but we don't always have staff for those beds. So becoming more and more of an issue. I saw another piece of news that was, it was kind of one of those wow type of moments, was the numbers would suggest that from June through August, we spent an extra $5.7 billion for hospitalizations of folks who hadn't been vaccinated. So June, there were 32,000 hospitalizations. July, 68,000. In August, 187,000 hospitalizations for hospitalizations. And of those, 7,617 were vaccinated. of that group of people, but the rest were unvaccinated. And it's about $20,000 per hospitalization to take care of a patient who has COVID on average. So the math on that's 5.7 billion, which, you think before that and before June of 2021, there were still a lot of people that had been hospitalized. And of course, now in September, there are still a lot of hospitalized patients. So pretty significant monetary toll, as well as, of course, even more so the human toll of just this vaccination, unvaccination situation. This week, too, across the country, these monoclonal antibodies, it's basically a treatment for someone who is at high risk, who is exposed to someone who's had COVID or actually has COVID. And if you get this monoclonal antibody treatment within a certain time frame, it really reduces your risk of hospitalization or death. And so there's been a lot of that being requested, to the point where this week the Biden administration is centralizing that, because, like, for instance, the Deep South is using about 70% of those doses right now, and they're kind of beginning to move towards a scarcity type of situation, or concerns about, will we have enough of them? So yeah, that's going to be dispersed centrally based upon cases and everything. We still have enough here at the hospital to take care of the patients, and we continue to give those infusions to patients who fit those categories. But yeah, and granted, it's free to patients, that medicine is, but it's not free. So it's about $2,100 a dose for the government to buy those doses of that monoclonal antibody. Questions that have been running through my mind. Here's a pre-show viewer question. Yeah, what do you think about unvaccinated kids in large-scale sporting events outside? And should kids stay masked outdoors when around other people who's vaccinated instead? This is unknown. Yeah, I would say what we know now, it sure seems reasonable for kids to be outside and doing activities outside, including sporting events, around other kids, even those kids that may or may not be vaccinated. Is there a risk? Yeah, there's a risk, but there is a lot of natural ventilation that occurs outside versus inside. The airflow around someone when you're outside is much better than oftentimes when you're inside with airflow. So I think it's reasonable. I think there's a risk. I think that risk is, at least what I've read, is not so high that it would keep us from having kids be outside and not wearing masks and not doing sporting events. So that's my take on that for now. That could change based upon our case numbers and those type of things, and more information that comes in about that. But for now, that would be my answer to that question. What else do we have here? Opinion on vaccinating kids under 12. You hear horrible stories about younger kids experiencing side effects after the shot, and it makes scary to think about having your children experience that. Yeah, I understand your concerns about kids and getting the shot if they're under the age of 12. I think the folks at FDA who are making those determinations are definitely factoring in what they are seeing in terms of the number of kids that are having reactions, or particularly what you're referring to is the myocarditis reaction, which is an inflammation of your heart we are tending to see more in males, and particularly adolescent males, than others. And also the number of kids who are, let's say 20 and under, who get COVID and then either are hospitalized or die from COVID, because those numbers are obviously lower than someone who is older. What I've seen so far, I think, first of all, I don't think there's, let me start that again. The risk for kids who are younger, let's say less than 18, are still significant. They're still there for if they get COVID. Hospitalization, death. You can get myocarditis from COVID itself, let alone from the vaccine. So I don't know how the FDA is going to land on that. For instance, in the UK, I think what I've read is that I think under 15, they're not recommending vaccination. So I don't know how it's going to play out here in the US. I'm not privy to that number and all that data to make up what's going to happen and even to make a recommendation about that. I think I tend to fall in this camp. I think the FDA does a pretty good job of taking into account the pros and cons of getting vaccines and giving vaccines out. And they want to see a significant pro to giving the vaccine before they go forward with recommending it. So I think if that happens, it will be after the evidence points in that direction. And I think the reason that you're not seeing it yet is because they're still looking that all over. I think for that reason is why, I'm very comfortable. The FDA is very comfortable that for 12 and up, it makes good sense. The further along the age group that you get to get a vaccine makes perfect sense because the pros are so much greater than the cons. So anyhow, a long answer to your very good question there. Hope that helped. All right. Where was I? Oh, questions. My questions, the things that are kind of mulling through my mind. And yeah, this whole third shot thing continues to stir up questions. And, I think those answers we're trending in a direction, but I just don't think we have that yet. Some of these vaccination mandate questions obviously are percolating through my mind, and I'm sure many of yours. When will it start? Will there be, how will these, I'm sure there'll be court or have been court challenges, and how will that impact that? How will it affect the workforce in terms of if folks have to get vaccinated and they say, I'm not going to work if I can't be vaccinated? What will it do to, and this is a very positive spin on this whole thing, but how will the mandates improve our numbers in terms of numbers right now, future surges, hospitalizations, and deaths? I know it's going to happen. I'm sorry, I'm going into opinion analysis quickly here, but yeah, if you get more people vaccinated, it's going to have an impact in terms of the disease and death that occurs as a result of this infection. So what are those mandates going to do in terms of improving the situation? Because it definitely will. We'll see. Something that's kind of beginning to come up now, and will there be allowances made for people who have natural immunity? So if you've had the infection and you have a blood test that shows you have antibodies, will that be good enough? And will the data and the research bear that out? Will that get us close to this herd immunity? Yeah. And another question I just can't get out of my head is, the longer that we go, that we continue to have this fester, will there be another Delta-like variant that pops up and becomes ever present and cause further surges here in the US and the rest of the world? So questions without answers. But those are just some things that I'm thinking about, and I value any questions that you might have about all that too. As far as analysis and opinion goes, so in my opinion, we need to get back to normal life ASAP. Because I alluded to this during already, that you look at obesity, it's becoming even more prominent as partly related to this pandemic. We're seeing cancers that are being diagnosed later, which means for poorer prognoses for patients. We're seeing increased mental health concerns for people. So yeah, it's really important. I want us to get back to normal safely, but back to normal as soon as possible. Matt, would you show the graph that we've shown before? So from my perspective, and Matt's going back and forth with the arrow because this is a dynamic situation, that there's a natural immunity is those folks who have had COVID and are less likely to get sick because they've already had COVID. And then vaccination, which is another way to significantly reduce your risk of getting COVID again. Against the longer we don't have this under control, you get more variants, and you get more variants, you get more risk of those variants that potentially can spread like the Delta did, and may or may not make you sicker than Delta and Alpha variants did. And then, of course, behavior and how we go about living our lives, because that has an impact, of course, too, on what happens in terms of all of this. So, and Matt, you can take that down if you would, thanks. So natural immunity, it is an option. So I just don't think it's a good one to just count on, okay, well, just go do your thing. Let your behavior be what your behavior is going to be. And it'll eventually all be under control because enough people will have it. That's a natural immunity route. I don't think that's a good fit, in my opinion. You're going to have more opportunity for variants to occur. You're going to have more surges. You're going to have more opportunity for the vaccines to be not as effective. You're going to continue to have pockets of surges, which means that you're going to continue the normal life that we want to go about is going to be tough. It's going to be tough because you're going to continually have situations where you need to mask, or you need to do this or that. You're going to have a lot more hospitalizations and the death and the cost and I tell you, I was, and just the cost to staff of our hospital, just the ongoing strain that it puts on staff. And, I in my opinion, I think part of the staffing that we have across the country is somewhat reflective of staff just saying, no, I don't think I want to do this so much anymore. That's part of it. It's not all of it, I'm sure, but so yeah, I mean, there's a toll on staff, and I think if you're living and you're not in the hospital, you don't realize all the stress and strain that this pandemic continues to put on those folks who are taking care of those sick patients here in the hospital. And it just makes it slower to get back to normal to do this natural immunity option. So I still fall heavily in the camp that vaccination is our best option. We know it's safe. I understand the questioner about like young kids and whether what bucket they'll fall into, but the people that right now that have been recommended to get vaccines, by and large, we know they're safe, way safer than getting COVID. We know they're effective. So that's the big picture. I think the smaller picture in terms of vaccination is going to be, is it going to be for everyone that we recommend? We obviously, big picture is everyone should get vaccinated, at least those for the Pfizer and Moderna, those first 2 shots, and for let's say the J&J, that first shot. But, it's going to have to sort itself out about for a third shot. We've already recommended for people that are having immune compromised situations that they should get a third shot. But, for people over a certain age, should we think about them getting a shot? For healthcare workers or people that were vaccinated really early on in the pandemic, when is there a time when we'd say, I think it makes sense to get the shot? And also, though, we have to weigh that against the rest of the world, because the rest of the world also can develop variants which spread to everyone as well. So, weighing in a third shot for countries that have access to the third shot versus moving some of those or most of those to countries that haven't had a single shot. And so I think that needs to get sorted out. What do we have here from Jennifer? What is the final word people that have allergies getting the vaccine? Severe peanut allergy and egg whites and many other foods and outdoor allergies. Is the vaccine safe for her? Jennifer, what I've read is yes, it would be. That's what I'm hearing, and that's what I have read. Jennifer, I do think, though, that I can get you to, if you can give your contact information to our marketing department, I think we can have someone here at the hospital give you a call and have a conversation with you about that, just to hear a little bit more about your concerns and answer any questions from the information that we have. So if you're willing to, just you can send that to our marketing folks, and we'll reach out to you a little bit and have a further conversation. But thanks for the question. What else? Where was I at? Until with things with the current surge simmer down, though, here's just a few my recommendations here. Don't neglect taking care of yourself. Try your best to eat a good diet, exercise, do things that for your mental health will help you out. That's connecting with your friends. If you have mental health issues, reach out to mental health professionals or to your primary care physician to have conversations about that. Don't neglect that. Don't neglect routine screenings. If you're having physical symptoms or complaints, seek out medical care for that. Don't put those things off. Secondly, get vaccinated. I know I keep hammering that home, but please get vaccinated. Thirdly, when you're indoors in public places, wear a mask. It's safer for you to do that, and I think it also helps the people around you. So wear a mask when you're indoors. If you're in crowds, distance as much as you possibly can. I know this sounds trite, but reduce or stop things that make you frown or make you not feel good. So whether that's watching TV, whether that's newspapers, whether that's social media. I know I'm on social media talking to you, but if there are things in social media that you just find that, you know what, when I get done reading that, or as I'm reading that, I feel my body changing and getting stressed. Don't put yourself through it, or at least not as much. And I would also encourage you to do things that make you smile. So if you like to listen to music, if you have a song that you just like to sing to, like I said, in a safe way, hang out with your friends and your family. And if you have something you like to watch, some comedy or show that you find that you're really into. I've been addicted to Ted Lasso in the last few months here, stuff like that. Go for it. And those things are good for things that make you smile are good for your health. They improve your immune system. So I'd encourage you to do that as well. I think that's all I have to share for this week. And I thank you for those of you who have listened. And I thank you for your questions. And I thank you for all that you do to try to make this world a better place and a safer place. And until next week, have a great week, have a safe week, and we'll talk next week.